Hello guys, welcome to Examdays. So in this video we are going to discuss about MLHP entrance examination bits part 9 in the series of 100 videos. So today the first question is going to be the instrument that detects and records a fatal heart rate is a what? An instrument that it indeed detects and records a fatal heart rate is a what? So you have a total 4 options. Options A, ultrasound transducer, B, tachydynamometer, C, fetoscope, D, accelerometer. So here is the question. You have to understand that what is meant by a fatal heart rate, which is this heart rate is detected in which of the following instrument. The correct answer is option C, fetoscope, where the fetoscope is a endoscopic procedure during the pregnancy to allow surgical access to the fetus, the amniotic cavity, the umbilical cord, and the fetal side of the placenta. The small incision is made in the abdomen, and an endoscope is inserted through the abdominal wall and uterus into the amniotic cavity. So this is the procedure where we have to going to detect the record of fatal heart rate. Moving on to the next question. A nurse can access a mother of her postpartum infection by the finding of what? A nurse can assess a mother for postpartum infection by the finding of what? Your options is going to be A, increased temperature of 100.4 degrees Fahrenheit within 24 hours. B, elevated WBC. C, increased appendix. D, increased pulse. Your options, option B, elevated WBC. Explanation as given here. The high white blood cells count usually indicates an increased production of white blood cells to fight infection. A reaction to a drug that increases white blood cells productions. A disease of bone marrow causing a abnormally high production of a white blood cells. So here we given one video image for the reference purpose. What is the different types of white blood cells? So here is given neutrophils. So these are the measurements as measuring during the blood test. We will call as a complete blood test. Moving on to the next question. The weight of the nulligravid uterus is what? The weight of the nulligravid uterus is A, 60 grams, B, 120 grams, C, 800 grams, D, 1000 grams. Your options is going to be, the correct answer is A, 60 grams. The weight increases from the 50 grams in a non-pregnant stage to 1000 grams at a term. This is due to hypertrophy of muscle fibers and their multiplication increases in the mass of the elastic connective tissue. So this is going to be starting approximately 50 grams. So the average is going to be 60 grams of the weight of nulligravid uterus as given. Moving on to the next question. Breast extend from what? The breast extend from 2 to 5th rib, B, 1 to 4th rib, C, 2 to 6th rib, D, 3 to 6th rib. The correct answer is option C, 2 to 6th rib. So here is given the breast tissue extend horizontally, which we call as a side by side from the edge of the sternum, the firm flat bone in the middle of the chest, out to the midexcellary line, which is the center of axilla and underarm. So the tail, the breast tissue is called axillary tail of Spence, extending to the underarm area. So here is given, second, so the answer is going to be 2 to 6 rib. So this is the second rib, this is the exact location as given. So axillary rail breast is another location, so that every location as given. So here is a 6. So this is the part actually as given, 2 to 6 rib, as the breast will be extend from here, this position to this position. Moving on to the next question. For a normal delivery to takes place, the suprapubic angle should be what? For a normal delivery to take place, the suprapubic angle should be A 65, B 100, C 90 and D 80. The correct answer is going to be option C, 90. So as we know, the angle will be, here is a 90, 180, okay, and 270, and here is a 360 degrees. So it will be this in the position. So the normal delivery takes place, the suprapubic angle should be, is going to be 90 degrees. So this is the shape which we call as a 90 degrees. Okay. As explanation as given, but the same thing. Moving on to the next question. Which of the following remains constant during the psychological changes of pregnancy? Which of the following remains the constant? So which we will not be changed. So it will be the constant part during the psychological changes in the pregnancy. So in a psychological, which will not be changes, it will be the constant. So this is the beauty called as a psychological changes in the pregnancy. So A is a PR, B BP, C O2 consumptions, D blood volume. So in a psychological changes in the pregnancy, the blood pressure will be the remains constant. Yes, this is the significant increase in the oxygen demand during pregnancy. This is due to the 15% increase in the metabolic rate and a 20% increase the consumption of oxygen. So these are the factor will be increases during the psychological pregnancy. So there is a 40 to 50% increase in minute ventilations, mostly due to the increase in the tidal volume rather than the respiratory rate. So here is given the normal, elevated, high blood pressure and hypertension crisis. So this is a normal actually, the how the blood pressure will be the changes. This is the measurement values of the blood pressure. Moving on to the next question. RH positive. RH positive, mother has to receive RH immunoglobulin. So at what? So in which week the RH mother has to receive RH value? So this is the value is going to be received at the which of the following week? A 14th week, B 26th week, D 32th week, and D none. So the answer is going to be none means. So the correct answer is going to be 28th week. So this is the correct answer where RH positive has to, mother has to receive at 28th week. As explanation is given, a small number of RH negative women may expose to RH positive blood cells from the fetus in the last few months of the pregnancy. It makes antibodies against these cells, where RH as given 28th week of pregnancy destroys these RH positive cells where into the woman body. So where RH positive mother has to receive at 28th week of the pregnancy. So these kind of questions are very famous. I have seen this kind of questions are asked in the many examinations where the pregnancy related questions comes. Monozygotic twins, other name. Your options A fraternal twins, B identical twins, C univocal twins, D. Both A and C. The correct answer is going to be univocal twins. Where explanation is given, the identical twins are also called as monozygotic twins, which result from the fertilization of the single egg by a single sperm, with the fertilized egg then splitting into identical twins share the same generics are always of the same gender. So here is given the terms where the difference between the egg, the sperm will be anterior and the single egg and it's converted into two, so this is shared placenta. But here is a one egg we converted into two part, but there is separate placements. So this is the difference between the identical and fraternal. Moving on to the next question. Which of the following Bishop score indicates the readiness of labor by induction? Which of the following Bishop score indicates the readiness of labor by indication? A2, B4, C5 and D is 7. The correct answer is option D, 7. 7 modified Bishop scoring is a method used for the cervical assessment during the labor. A score of 6 or higher is considered favorable of labor inductions. So this is the table as given for the reference purpose of the candidate, where we have to check it out what is the Bishop scoring method used for the cervical assessment during the labor. Which of the following is the dash type of the episiotomy? Which of the following is the what dash is the type of the episiotomy? A. Lateral, B. Medial, C. Mediolateral and D. Parallel. The correct answer is going to be option C. Mediolateral. Where mediolateral is related to extending the long or being direction of or axis in the side by side from the medium to lateral. So here it is given the option is mediolateral. So this is the exact what the question is asking is that dash type of episiotomy. Okay, so this is the answer is mediolateral. Which of the following finding indicating umbilical cord compression? Which of the following finding indicate umbilical cord compression? A. Late declarations, B. Early declarations, C. Short-term variability, D. Variable declarations. The correct answer is going to be the variable declarations as given. So here is the variable declarations or irregular, often jagged dip up into the fertile heart rate that looks more dramatic than the late declarations. These variable declarations, as it is a declarations or say declarations happen when the baby umbilical cord temporarily compressed. It is happen during the most labor. So which we can call as declarations. So this is not the declaration, it is a declarations. Okay. So late declaration, early declarations and short-term variability. Fourth one is a variable declarations. The correct answer is going to be option D, variable declarations. Moving on to the next question. The virus does not crosses the placenta usually is what? The virus does not crosses the placenta usually is not is a what? A. Toxoplasmosis, B. Rubella, C. Cytomega whole virus, D. Herpes. So the correct answer is going to be herpes is the correct answer, where the virus does not crosses the placenta. So here is given, this is the one example as given for the understanding purpose. This is the called as a herpes is a viral infection that causes the blisters or sores. So this herpes can be infection maybe not only on the face, lips, it may be hands or anywhere in the human body skins. So this will be a normal a virus will be infected. So this virus causing the contagion is a source most often around the mouth or on the genitals. So even you can observe this in the hands also. So we have so many questions today. So moving on to the next question. The average duration of viability of a sperm is. So this is what actually you have to understand. The average duration of viability of a sperm is A. 12 hours, B. 24 hours, C. 36 hours, D. 96 hours. So the correct answer is going to be mostly is 36 hours. So it is not asking about lifetime or lifespan, but it is asking the viability of the sperm is going to be 36 hours. If you see the life remain viable of 7 days as given within the female reproduction tract, fertilization possible along with the sperm alive, but it is asking what is the viability of the refers what is meant by. So live sperm in the female sample, this is especially increasing the measure of sperm mortality is low, but the correct answer is going to be 36 hours. So this is ejaculated sperm remains live sperm is different, whereas the viability of sperm is different. The normal gestational period is about 260 days, 280 days, 360 days. The normal gestational days is almost 280 days. 280 days. So here is given the image from day 1, day 2, day 3, 4, 5, 6, 7, 8 and 9. So here is how many days which comes under the 40 weeks. So when it count in days, it's going to be 280 days. So the pregnancy lasts about 280 days. A preterm or premature baby is delivered before 37 weeks of your pregnancy. Extremely preterm infants that born 23 to 28 weeks. Preterm infants are born in the 29 to 33 week. So this is the common terms. 29 to 33 week is the safe and normal delivery. When teaching a client about contraception, which is the most effective method to prevent STD. STD means sexually transmitted disease. Options: spermicides, B. diaphragm, C. condoms, D. vasectomy. So which is the most effective method to prevent the STD? As we know, the correct answer is going to be C. condoms. Yes, where the condoms is the only type of the birth control that protects against the sexual transmitted disease. It is used correctly. Yes, condoms are also fairly effective at protecting against the pregnancy, but they are not as successful as a hormonal methods like pills, patch, ring, IUD or shot. So the correct method is mostly to control the disease. They also control the diseases. Next question is going to be priority nursing diagnosis for a client with ectopic pregnancy. A. pain, B. risk for infection, C. anticipatory grieving, D. knowledge deficit. So especially for the client with ectopic pregnancy is going to be pain. So guys, moving on to the next question, it's going to be which cause a reddish stain on the diaper of a newborn. The question is once again, which cause a reddish stain on the diaper of the newborn baby? A. mucose, B. uric acid crystals, C. bilirubin, D. excess iron. The correct answer is going to be option B, uric crystals. As explanation is given, which is not related to the newborn baby, so we have to modify the explanations. Moving on to the next question. The newborn heart rate that would be considered a normal if newborn baby is sleeping. When the newborn heart rate that would be considered as a normal if newborn is sleeping. A. 80 beats per minute, B. 100 beats per minute, C. 120 beats per minute, D. 160 beats per minute. As we know, the normal is the baby is going to be 120 beats per minute. So normally 120 to 160 beats per minute. It may much slower when in fact asleep. So this is the normal heart rate has been calculated when in the newborn infant. So this is all the question, guys. Don't forget to download this PDF. The link will be available in the description box. The PDF is available for regular subscribers and also viewers. So guys, like the video and share the video, and don't forget to subscribe Examdays TSAP channel. So if you have any questions, any doubts or any suggestions during the MLHP questions, use the below comment section and you have to comment the questions. Thank you for so much, and we will meet in the next video.